All right, our coronavirus update for the day. Here are the confirmed cases worldwide. 1,359,010 people. That's up. That is up almost 100,000 from yesterday. Total confirmed deaths worldwide up 5,000 to 75,906. We now have 367,650 confirmed cases. That is up from 336, so about 30,000 cases. New cases were confirmed yesterday. 9,600 deaths yesterday to 10,943. That's 1,300 more deaths. That is an astonishing number. Now, in the Motor City, there are more than 700 employers in one Detroit hospital system that have now tested positive. 700 employees, 700 people in one hospital system. This is the Henry Ford Hospital campus. They confirmed yesterday they have 731 cases of coronavirus among the employees at the hospital. That accounts for 2% in the hospital system's 31,000 employees. There is as many as 1,500 at another hospital in the state that have reported symptoms similar to the coronavirus. Those numbers are not confirmed cases yet. The doctors say if we are going to test the whole population, you would see large numbers of people who are testing positive. Testing positive is a measure of how contagious this virus is. It doesn't mean how deadly it is. The hospital put out a statement saying our team members are our greatest asset and the health and safety is top priority as we continue to respond to this pandemic. That is remarkable, the number of people sick in this hospital. We know we are not immune to potential exposure, and we remain grateful for the courage and dedication of our entire team. Detroit, Michigan's largest city, has seen a surge of coronavirus cases in recent days, while the state itself has seen just over 17,000 cases of the virus, the third largest total of any state in the U.S. More than 5,000 of those cases were reported in where hundreds have already died. The invisible enemy is COVID-19 hiding in our cells. COVID-19 may be able to remain in the body and reactivate later. This comes after testing 51 recovered patients who found themselves with the same symptoms. The patients from South Korea had spent time in quarantine while recovering from the disease, and they passed all the tests and showed that they were coronavirus free. They were released. Within a couple of days, they were back in the hospital. The center said it did not believe the patients had been reinfected, but that the virus had remained at an undetectable level in their cells and, for some reason, later reactivated. The claim runs contrary to the bulk of current evidence about how the virus works. Investigators say the most likely explanation was that the clearance samples for the patients were false negatives. This is a common issue. Now they're saying maybe we shouldn't go to the grocery store at all. Coronavirus deaths are spiking in Los Angeles, and with the critical week ahead, health officials have advised residents on Monday to stay at home and avoid shopping to limit the spread of the virus. If, officials say, you have enough supplies in your home, this week and next week, you should skip going out or doing any kind of shopping whatsoever. Officials confirmed 420 new coronavirus cases in the county and 15 deaths on Monday. Have you heard that there is a surge now coronavirus with those people who were working in grocery stores? They are starting to get sick now. The biggest problem that I see coming from this, besides the American economy and what's going to be done with socialism, comes from Mexico. Mexico, this is the first time I've seen this story. Mexico's slow response may cause problems for Texas. As recently as March 15th, some 40,000 concert goers crowded into a stadium for the Latino Music Festival. Tourists from Europe and the United States were able to enter the country without any restrictions until late last week. Restaurants, airports, subways, grocery stores remain open in Mexico City, though churches and large markets have closed. The rapid spread of the COVID-19, however, has begun to increase the urgency of the government's response. Mexican health authorities reported on March 16th the country only had 82 cases of COVID-19. 2 weeks later, that number swelled to nearly 2,400, including 125 deaths. The health minister, Hugo Lopez-Gatell, who 2 weeks ago dismissed U.S. social distancing restrictions as an extreme tactic and irresponsible, is now urging citizens to stay home, stay at home, stay at home, end quote. If you have enough food, stay at home, still quoting. There is no reason good enough to go out, period. The President Obrador, spent the first half of March dismissing the gravity of the virus, encouraging Mexicans to frequent restaurants and posting videos of themselves in crowds kissing babies. He said Mexico's spirituality is going to protect the country against the virus, and he made a public display of pulling out 2 religious amulets that he said would be his shield. And finally, is this the virus or the big government communists in China? Hong Kong is now closed to all foreign travelers indefinitely. The city has extended its ban on arrivals after most cases over the past 2 weeks have come from overseas. Only 6 of 24 newly infected yesterday are local transmissions, but all are linked to entertainment venues that are already closed. All entertainment venues are closed until further notice. Hong Kong recently issued a new state of emergency order revoking travel into the country from outside the nation, including China. The order will prevent Hong Kong from opening up its economy through at least early May. There's one more story that we missed yesterday, and that is, when do you think we're going to open up our borders and open up our economy? Well, there is a group that has done a study on this, on when we are going to open things up at all. And it shows that if we use the model used in China, it will be May 16th. If we use the SARS model, we won't be opening things up until July 18th. June 18th. June 18th. But with China opening things up and Hong Kong opening things up and it hitting again, all bets are currently off.